One of our deliverables is to ensure that we're planning and delivering training and education, providing resources to our staff to ensure not only is there inclusive and respectful service delivery to our patients, but that there is a respectful and inclusive work environment for our staff as well.
Our training is really focused on working in a diverse environment, and we've made that training mandatory for our leaders and for our staff. It's a very important part of our culture.
The organization felt that they were trying to figure out how to integrate their internationally educated professionals, because it's not just the physicians. We have nurses, we have social workers, we have physiotherapists, we have pharmacists, we have so many other non-professional healthcare staff members who are coming as well and working in our organizations.
What we do is make sure that we cover the values of our organization, and two of those 5 values, one of them is respect and the other one is diversity. Those 2 values are key in this particular training. There's a lot of self-assessment that's done, self-reflection. There's a lot of discussion that goes on to ensure that we're not only providing the training, but there's some significant change that comes about. There's e-learning that we have, tools and resources that we've developed in-house. For example, providing care and working with the Sikh population, or the Hindu population, or Jehovah's Witnesses, etc., etc. The senior leadership team want to hear updates on health equity and inclusion, how we're doing in the organization. At one of these formal updates, I pointed out that there have been some challenges in working in teams. So the senior leadership team recommended that we work with our managers, with the directors of those particular areas or that particular unit, and plan a training that was specific, that would meet the needs of that particular team. And that's what we did. We do have quarterly health equity forums. It gives staff, employees, physicians, volunteers to drop in and learn about different topics and themes that we've become aware of, that has been identified as a need. Anything that really impacts staff and employees and patients in our diverse working environments. We do put together, when we deliver our training, pre-assessments, post-assessments, evaluations, track what kind of behaviors have changed, if any, and that really gives us a good idea whether the training has been effective or not.
We really at the Scarborough Hospital wanted to look at staff education related to diversity in different ways. Really, at the end of the day, mandatory staff education that talks about compliance and legislation really is not a compelling enough reason for people to change behaviors and attitudes.
All our staff have been through diversity training over the past 2 years, and it's part of our ongoing training and approach. So every year we have a diversity focus under our learning and development needs for our staff. There is a classroom session just on what diversity means, on what inclusion means, on what equity means.
Since 2011, we have ran a series called Embracing Diversity Through Personal Journeys. We've invited our staff and our community and patients as well to attend these sessions, and our staff have also participated in sharing their stories. And what really has been amazing is that staff, other of their colleagues that listen to their story, really recognize and learn from their experiences some of the challenges and obstacles that they might not have recognized or realized that their colleague has faced. It's a powerful tool. And it's one that we have found so much of our staff have been so engaged in, and we've had great participation and engagement around it. We have made mandatory for all of our leaders to do bias-aware education. And we found it was really important that we moved beyond legislation and compliance to really being able to spend some time better understanding my own biases, because we all have biases, but it's about being aware of those biases and being able to mitigate that before it becomes discriminatory practices.
Last year we introduced a certificate program for our staff. You're constantly getting new staff in the door, so it's important to make sure that on a constant basis you're providing that training and refreshing that on an annual basis.
We always think about what does the system need, what does the professionals need, but what about the internationally educated professionals themselves? What do they want? We had an organizational development expert, and she and I collaborated and designed workshops focusing on communication and focusing on understanding the feedback. And the difference about that workshop was because we were not just talking about communication and feedback in Canadian context, but what is the impact of culture on it?
What are those strategies that are important in a Canadian culture, or at the same time, a Sunnybrook culture?
We were surprised by how much interest there was. Like, we got people who were working in Sunnybrook for 13 years, 15 years, came to attend our workshops. And since then, now we have consolidated them into 2 workshops, one on communication and one on feedback, and we were offering them twice a year. So this is our 5th year.
So these 2 programs are 3 hours in length, and they allow for those rich discussions and at the same time taking away some key tools on how to integrate.
And I think the workshops have gone beyond the boundaries of Sunnybrook, because 2 of the training programs at University of Toronto, the Hospitalist Fellowship programs, one at Sunnybrook and one at Toronto General, now they send their IMG fellows to attend our workshops.
We do language communication for nurses advanced. It's a workplace communication specifically set up for the internationally educated nurses. Job shadowing, we get them to the 2nd general nursing orientation, which are usually for people who are hired at HHS. So they come in contact with people that they succeeded in their hiring, so they feel encouraged now. Because they will see among those people some of their colleagues, INs or ESLs. So that's a bonus for them, they understand. And also we have a career progression. In the career progression, we do different lunch and learns. We have an office where we have an e-lounge where they come and they're able to access different skills, review their skills, different policies we have here at HHS. We develop a learning plan for them. That's another intervention. Also, we do a job coaching mock interview. That's another thing that we do. And we have an networking program. It's called Nursing Nurturing Nurses. It's based on the American model it comes from the Medical Surgical Association of nurses in the States. It's called N3, and we're trying to develop this one into an IN network. And what we prepare through this network are the clinical integrators, the informal mentors who are supporters of the IN ESL participants.
The program in particular has done a lot of work to understand how you are entitled to basic human rights here, and that you're allowed to ask for those things.
And after they're being hired, the most important thing, workplace integration and retention within the team community that they have, within the hospital as well. But taking it a step further is integrating in the community where they live as well.
Some of the education is not just to our IENs, it's to our staff group to say, how do you welcome someone who has some differences? Well, we try to reinforce mutual purpose. We try and reinforce mutual respect as key components.